Welcome to Talk Law Radio with attorney Todd Marquardt of the Marquardt Law Firm at marquardtlawfirm.com.
Welcome back to Talk Law Radio. I'm Todd Marquardt. On the radio, on podcasts, on Facebook Live, and on YouTube. Today we're talking with two Dr. Musas, Dr. Hussein Musa and Dr. Adetoun Musa, and we're talking about their unique approach to medicine. And we went over their background in the previous episode, so if you want to know more about their training and education, check that out. Now I'd like to talk about your unique practice. What did you call it? Specialty direct care?
The name of the practice is Kingdom Healing Institute, and it is a direct specialty practice. Direct care really just means that we don't bill insurance companies. It's a very simplified model, and it is great for patients who are looking for medical care quickly and higher quality medical care.
Who told you about this? How did you get started? Because in San Antonio, my whole life and my parents' whole lives, I've been introduced to health insurance.
Yeah.
And so how did you know that there was a different way?
Yeah.
Well, the reality is health insurance does not equal health care. And anybody who's had to really delve into our health care system has found out the difference the hard way and the expensive way. Now, we were fortunate. We have a family member who started a direct care endocrinology practice in Savannah, Georgia, and has been extremely successful. Shoreline Endocrinology, she's amazing. Dr. Abby Sogun. Hi, hopefully you're watching this. So she took us under her wing. We hired her as a professional coach, and she saved us so much time, so much frustration. We learned what direct care practice is. So a lot of times there's a complication between direct care and concierge medicine, and learning the difference and how to market directly to our patient population. It's different, but we find that it's been very effective because people, especially for neurological complaints, there are no options. So we found a very important need in the community, and I think we're able to fill a void, especially with neurological care.
Let's talk about that,
Yeah.
the type of conditions that you treat.
Absolutely. So my subspecialty training, as I said before, is epilepsy. But I treat all neurological disorders, anywhere from migraine, TBI, stroke, any dementia, Parkinson's disease, or any sort of neurodegenerative issue. I could treat people with diabetic neuropathy. Honestly, it's a pretty wide range. What I found is that a severe pain point in the community is having a severe neurological issue and not being able to get an appointment in a timely manner with a specialist. It typically takes about, we used to say 3 to 6 months, but in my research and data collection, it's really 6 to 9 months to see a neurologist for your complaint. I didn't mention brain tumors. I also have a lot of experience with neuro-oncology, which is the study and the management of brain tumors. And I have example cases of people who have very severe tumors, and they can't get seen till September.
Yeah. You should just go ahead and tell them this story.
Well, it's a story of a patient who was seen by a nurse practitioner or primary care provider. The primary care provider ordered a scan because she had been complaining of headaches and other symptoms. The scan comes back with a large tumor in the back of the brain. So the back of the brain houses a very important structures like the balance centers, the cerebellum, but more importantly, there is an area that is able to drain the fluid out of your head, right? If that area is blocked by, let's say, a tumor, it can cause an emergency situation and increased pressure and maybe even herniation. So the nurse practitioner faxes us the information after a Google search and calling multiple neurologists who had no room in their schedule.
Oh, wow.
And I look at this scan and I'm like, okay, let's see this patient. I think we saw her in 2 days, within 2 days.
Yeah.
I was able to educate her on this scan and send her to a neurosurgeon because honestly, the definitive method of treatment is to remove the tumor. An excellent neurosurgeon, Dr. Bogave, and he agreed to do surgery within 2 weeks. So
Oh, wow.
she's actually due for surgery soon. Yeah.
Okay.
Yeah.
Well, that was
It's better
much faster.
Better
Yeah.
than September 2024.
Which could have been fatal.
Maybe. Yeah.
But she was still paying her monthly health insurance premiums. So keep that in mind that healthcare is not health insurance.
Yeah.
Okay, so Dr. Hussein, tell us what you do or what conditions would you treat?
So I treat chronic pain. Most commonly, patients have low back pain, sciatica, nerve pain, arthritis, fibromyalgia, headaches, shoulder aches, knee aches. So if it's a joint and it hurts, I usually can treat it. And I also treat a lot of these widespread pain syndromes. There's patients with, you can call them different types of arthritic syndromes. They may have positive lab findings or negative lab findings, but they have pain. Or if you have pain and your doctor doesn't know why and nothing they've done has helped, that's also another reason why they would send you to a pain specialist. So I typically will see patients who aren't able to get seen quickly, or they just want a second opinion, or they want to see if there's something else that can be offered. So in our practice, we're able to do ultrasound-guided injections. We're able to do some holistic approaches. We have different technologies to help with pain. And also, there's a lot of education. For example, the average specialty visit is about 7 minutes with your doctor. And what I find is 7 minutes is not a lot of time for a patient to explain their problem, the doctor to educate them, and everybody to leave the appointment feeling that the problem is resolved. Unfortunately, we're left with a system that you have 7 minutes, the doctor will maybe give you a pill or some sort of medication, and they'll see you in 6 months. And that's what 7 minutes traditionally allows for healthcare.
Yeah.
Okay. Is that all the conditions you want to talk about? Anything else?
Well, some other conditions that I treat quite frequently are seizures and epilepsy. And there is a dichotomy. There are some patients who have very well controlled epilepsy and they just need refills, but they can't get to a doctor that would be willing to prescribe a specialty medication like that. So I do see a lot of those patients. And then I see a lot of patients with uncontrolled seizures who are not on the right medications or who are suffering from medication interactions and side effects. With that typical 7-minute doctor's visit, it's very hard to go through and reconcile their medications and to walk with the patient in such a way as to simplify their medications so that they live a better quality life and you're picking something that is most effective for their epilepsy or seizure disorder.
Another thing that we've been seeing are patients who are concerned with their memory or maybe mild cognitive impairment. We started to do holistic treatment programs, even using neurofeedback to really help patients improve their brain health. And also you can mention some about the nutrition.
Yeah. So we're actually the first ever dietary therapy clinic in San Antonio. It's a medically directed dietary therapy clinic. We use the ketogenic diet and the modified Atkins diet for the treatment of epilepsy. Typically, these seizures are very hard to control, or these are just patients who are tired of the merry-go-round of medications and would like to try something different. It's a multidisciplinary clinic. We work with a registered dietitian, and we have been recognized by the Charlie Foundation.
Oh, okay. I had a friend who, after law school, was diagnosed with MS.
Yeah.
And part of his treatment is a special diet.
Right. There have been some studies showing that dairy, for instance, can really exacerbate the inflammatory nature of multiple sclerosis.
Does that mean ice cream?
Yeah.
Okay.
It means ice cream. So
The humanity.
there are definitely some things to change about diet, and that's a question I get frequently asked in MS patients as well.
Let's talk about the hidden legal issue blind spot. How can you run a practice without Medicare?
Good question.
Yeah, so you have to make a decision. Some people will just not see Medicare patients, which really doesn't address the issue. So we actually opted out of Medicare, which is really a commitment for as a physician, because Medicare provides care for patients 65 and older, meaning that you've just excluded yourself from billing Medicare, which is the largest payer source for seniors in America. However, you do have the option now to enter into a private contract with these patients. So it really becomes the patient's choice if they are willing to see you, knowing that Medicare will not reimburse them for their services. So you have to do a really good job explaining and showing that your services are really worth the investment.
Yeah.
And you have to take some active steps to make that known.
Yes.
Or Medicare gets upset with you.
Yes. So we actually had to fill out an opt-out form, and it had to be approved. And then when we see patients of Medicare eligibility age, we have to give them that notice, and we have to create a private contract
That they sign.
that the patient signs, so they agree that they're seeing a non-Medicare provider and that they're not going to receive really reimbursement for these services provided by a non-Medicare physician.
Mm-hmm.
You know, when I went to Innsbruck to study international law one summer during law school, a friend and I went to northern Germany, and we were hanging out at a beer garden, and this English guy comes over to our table. He was there on a bachelor party type weekend, and he said, you know, y'all U.S. should make us, Great Britain, the 51st state, because he was so upset with the healthcare system there. He said, if you want an appointment, you got to private pay a doctor outside of their whole healthcare system.
Yeah.
Well, we got to take a break. I don't want to get into anything new just yet, but when we come back, let's talk about the power of prayer.
Yes.
Amen to that.
Amen.
This has been Talk Law Radio with attorney Todd Marquardt, brought to you by the Marquardt Law Firm. You can learn more at marquardtlawfirm.com. And be sure to listen to the full Talk Law Radio show Saturday mornings at 11 on 9:30 a.m. The Answer.
Each week, attorney Todd Marquardt talks about the law. His mission with the Talk Law Radio show and podcast is to help you discover your legal issue blind spots. In the beginning, God had one law. Don't eat from the fruit of that tree. Then came the 10 Commandments. Now we have federal, state, and municipal lawmakers that won't stop creating new laws. Laws that might impact you without you knowing it. Listen to the show and drop a line on Facebook or email host@talklawradio.com and let the host know what you think of the show, the topics you want to hear, and whether you want to be a guest.